Hey community, we're back, and I'm Brandy B, the community MP.
And I'm Brandy G, the community MP.
And together we are B&B, the community MPs. So today's topic is benign prostate hyperplasia. So,
or BPH.
Yeah.
Some people know it as BPH, or enlarged prostate.
Yes.
Okay.
Definition.
All right. So what is BPH or what is an enlarged prostate? So basically it's the medical definition is the proliferation of some of the prostate tissue, the glandular tissue, the smooth muscles, and the connective tissue. So basically it's multiplying of the prostate tissue, okay? So a lot of times it can be asymptomatic, but we're going to talk about when it's symptomatic.
Yes.
So when it's symptomatic, the prostate becomes enlarged, and so you start having symptoms. So that's what we're going to talk about today.
Yeah.
And the men start usually having lower urinary tract symptoms when it becomes enlarged. Okay.
So only men have a prostate.
Yes.
And the prostate is at like the bottom of the penis.
Yes.
Right?
Yes.
Yeah. So we can't demonstrate, but
no. I'm sure nobody's not gonna let you do a digital rectal exam on them to demonstrate how to do.
I wish we could get some volunteer patients.
No.
Not just for that, but for different stuff. Okay. But so some facts.
One fact.
One fact. There are 3 million U.S. cases of BPH every year.
And BPH is it's common. It's common. As you can see, 3 million cases. It's usually common in older men.
Yep.
Usually the older man experiences some type of symptoms from BPH, which uses from enlarged prostate.
Yeah.
Okay, so let's talk about some of the symptoms. So there's 2 different types of symptoms. There is what they call irritative symptoms, the symptoms that usually make them go to the bathroom frequently. You may wake up at night and want to use the bathroom, or some people have incontinence. They may just don't realize that they went to the bathroom and they're going themselves. And a lot of people have the urgency to feel like you gotta go, but when I get there, I really don't have to go. So that's some of the irritative symptoms. Yes. And these symptoms are the ones who usually make the patients come to see us.
Yeah.
Because it's like, I'm waking up all night trying to use the bathroom.
Yeah.
Because I gotta go and I can't go. So let's talk about some of the voiding symptoms.
Okay, so slow urinary stream.
Okay.
And so that just basically means that instead of that force being behind the urine, like the loud noise when you urinate, when it's hitting the toilet,
so
it is. Yeah. Right. Yeah, so the stream is slow and it doesn't have as much pressure behind it.
Okay.
And you might have to like strain
to void.
To urinate, and then urinary intermittency.
So what is that?
That's like the stream starting and stopping.
Okay.
Not all in one setting. So like you're in the bathroom, you're peeing and it stops, then you pee and it stops, and it pee and it stops.
Okay.
And then, or hesitancy, splitting of the urinary stream, or terminal dribbling. So, and that's just like never really emptying your bladder. It's just drip, 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 drip.
I've realized a lot of my patients comes, if you don't stop dripping, she's going to be dripping. So, but I also realized that a lot of my patients, you have to ask about these symptoms. I realized that because if you don't ask about them, they won't tell you about some of these voiding symptoms.
And why do you think that is?
They're men.
Yeah. Men do not like to talk about like their stuff going on.
They don't, unless they want something for erectile dysfunction. Yeah. That's the only time.
But sometimes they're kind of hesitant to.
The mine's not, girl. That's when they open to talk about it. When they want something for erectile dysfunction, then they want to talk about it. But a lot of times I have to ask them, when you urinate, does this happen? Are you starting and stopping? Oh, yeah. That's happening. It's been happening for a while.
Yeah.
I'm like, so you got to ask those questions. So I tell people all the time, a lot of people think, the doctor or the nurse practitioner, they know what to ask me or what's going on. You have to be an advocate for yourself.
Yes.
So you have to, if you have any type of symptom, you
got to say it.
You have to say it because we can't read minds. So you have to say it.
Yes.
Okay. So let's talk about the exam. So we know that usually do a physical exam. So what type of exam, Brandon?
A digital rectal exam.
Okay.
So, and a lot of times patients are so hesitant to like even bring up screening for their prostate because they're like, are you going to have to put your finger up my butt? and
so,
so it's uncomfortable.
Yes,
and it's uncomfortable for them and us. So
yes, it is.
We feel you're uncomfortable.
And sometimes you can do labs. You can just do a PSA and just to see if it's a slightly elevated. So sometimes labs, but really the digital rectal exam is what your
gold standard,
because you want to feel that smooth, firm prostate to make sure it's not lumpy. You know, so so men, you guys got to get your prostate
get it
exams.
done.
I know. So some of the complications. So some of the complications that can occur from having an enlarged prostate is urinary retention. So when you retain urine, guess what? You get a urinary tract infection. So men do get urinary tract infections.
Yes, and they're usually you have to treat them for longer, and most of the time they're more severe.
Yes. Okay.
And then chronic obstruction and failure to completely empty the bladder of urine increases the risk of urinary tract infections. And then bladder stones and renal damage.
Yes, that can occur for complications. So let's talk about some of the risk factors, Brandy. So who is at risk for getting for having an enlarged prostate or BPH?
So you're at increased risk if like your brother or your dad. So genetics.
Yeah.
Diabetes, heart disease, but you're at increased risk. Having a BMI or an enlarged waist circumference. So
use
work out do some cardio and get your waist small. Get that Coke bottle, guys. We need you with the Coke bottle.
I don't know about my man with no Coke bottle. I don't know.
Well, you know, it's 2021, so.
I don't know my man with no Coke bottle. Okay, all right.
Okay, get the six pack. Just get the six pack.
All right, that's fine. All right. So treatment. So one of the things you may want to do is some type of lifestyle modifications. Okay. So if you're drinking a lot before going to bed, cut back on drinking. If you're traveling and you know you may be getting up, going to the bathroom, you want to cut back drinking before traveling, okay?
Because you'll hold it.
Yes.
And then that increases your risk.
Yes.
So, of course, when you're in bed, who wants to get up out of bed and go pee?
Yes.
And who wants to stop every couple hours especially if you're on like a far travel?
Yeah.
I know whenever we drive to North Carolina, I'm like, we're going to stop like every 6 hours. It's like an 18-hour drive.
I don't want to drive with you. That's too much stopping. I'll tell you right now.
Too much stopping?
Yeah, because my husband only stopped one. He'll tell you, we want to stop making one stop. And you better do what you got to do in that one stop. So,
well, we don't want our car full of kid pee, so we stop.
So another thing you can do is you're going to limit the amount of alcohol and caffeine that you take. So especially if you do have an enlarged prostate, these are some of the things you want to do because you want to limit the amount of alcohol because there's a diuretic. Caffeine is a diuretic. So it's going to have you going to the bathroom more and more. Okay? What else?
Limiting the intake of bladder irritants like foods that are like overly seasoned or irritated foods.
That I love.
Because that's that New Orleans. Y'all like.
I like everything. Guys, they have some seasoning.
Cajun seasoning.
Yes.
On everything.
On everything. Yes.
Can you put some Cajun seasoning in my water, please? I love my New Orleans spread.
What else?
Avoid getting constipated. So drink plenty of water. Eat fruits and vegetables. Make sure you got a high fiber diet. And exercise. So exercising increases like the movement of the food in the gut, and so it makes it easier to pass. Okay.
And some other things you can do is Kegel exercise. And I know they had Kegel exercises for men, but I guess.
I learned a way to tell our people how to do Kegel exercise.
Okay, how?
So you they're basically like bridges. So you lay on your back.
You gonna do it?
Oh no, I'm not gonna do it.
Okay.
You lay on your back and then you thrust your hips, your pelvis up off the floor. So your feet are on the floor.
Okay.
Your back is flat.
Okay.
And then you lift your hips off the floor.
Like you're doing a crab?
No, don't put your hands on the floor.
Okay.
Oh my gosh.
Now
just lay flat on your back, hands down by your side.
Okay.
Feet on the floor.
Okay.
And then lift your hips and squeeze. So you're like squeezing your butt cheeks and everything.
Okay.
And the other way is just sitting here and squeezing your lower pelvic muscles.
Okay.
But some people can't do that. And some people can't understand how to do it. So got an alternative for you.
All right. Okay. Some other treatments are you can have a journal. You can journal when avoiding journal, so that your primary care provider can see like how often you're avoiding. Or you can do time intervals. Like I'm gonna use the bathroom at 6 every 2 hours.
Yes.
I'm gonna go ahead and go to the bathroom to empty my bladder. So those things help also. Also medications.
You know that time voiding also helps with like urinary incontinence.
Yes.
So we talked about that last week. So we'll put a link if you're having trouble with urinary incontinence. Got some good information for you.
Okay. So there's different medications also that you can take to help with BPH also. Okay.
So usually you'll probably see a urologist.
Yes.
And so they may prescribe some different medications for you.
Yes. And what I realized one day, one of my patients came in, I know he had BPH, and he was having erectile dysfunction. So I sent him to a urologist because he had other things going on. And when he came back, one of the medications was for erectile dysfunction. He's like, oh no, that's for my BPH, and they was able to pay for it. So some of those medications can be used interchangeably for erectile dysfunction and BPH. So he's like, I can get my medicine for free.
Yeah.
Like,
We've brought up erectile dysfunction quite a bit, and it's popular. I mean, not popular. Not popular. Well, but it's common. So we're gonna bring out some information on that.
Erectile dysfunction. Okay. All right, B. So that's really it about BPH. And one of the things that we didn't say was that BPH, because you have BPH, doesn't put you at greater risk for prostate cancer, okay? So that's why we didn't link those together, because I don't want you guys to think because you have an enlarged prostate, you have greater risk for having prostate cancer. That is not true. Yeah. So we're going to do prostate cancer on its own as its own topic. But that's it for BPH. Okay. It was short and sweet. Men, something short and sweet for you guys.
Yep, just for you. Yeah. But anyways, Brandy, tell them about the disclosure.
All right, so as you know.
As you know.
This information is just educational information for you to share with family and friends. To spark a conversation, period. It does not take the place of their primary care providers. We still want you to go see your primary care providers, okay? Yep. I tell people at least once a year, Brandy.
Yes.
Give me one time a year so we can do your preventative vision. If you need to come back more often, then we'll get you back more often. But at least once a year.
Yes.
Do you make your husband go to the doctor at least once a year?
I can't make my husband do anything. Okay? Let's get that straight, because I might encourage him. Okay. And so when he wants to listen, he listens. But my husband's like, you know that about that Tuskegee experience.
Oh God. My husband, I make him go once a year.
I know he comes to see me.
That's his primary care provider right there.
No, but my husband, like if he gets really, really sick or something, then he'll go, and we'll just kind of get everything done.
But that's most men.
Yeah.
They go when they're really, really sick, or they can't, I just can't tolerate it anymore. Yeah. That's when they go. But if we want to encourage you guys to do your preventative visits. Yeah.
Yep, you should.
Yes.
Husband, you hear that? Brandy Gray said you should go and get your...
Brandy Davis.
Oh, Brandy Gray Davis said go and get your preventative done.
Yes. All right, B, so tell them where they can follow us at.
Everywhere. Okay. No, Facebook, Instagram. Subscribe to our YouTube channel, B&B the Community MPs. Interact with us, ask us questions.
And we still have some I'm not gonna call them diapers.
Briefs.
Yeah, so if you guys
adult briefs.
Anyway, don't be afraid, ashamed. You can privately DM us.
Yeah.
You don't have to put a comment on a page. They can send us a message and we can get those to you.
Yeah. And if they're for you and you don't want us to know, just say, I need them. We're not asking questions.
No.
We're just giving y'all stuff.
Yes.
I think we still got glucometers,
and
blood pressure
cuffs.
Yep.
So, yeah.
This stuff is free.
It's free. It is. Free. I dropped some briefs off at a patient house probably like a week ago. And he was like, how much I owe you? I'm like, you don't owe me nothing. It's free. He was like, it's free. So I gave him 4 boxes. He was like, this is going to save me a whole lot of money.
It will, because those things are expensive.
Like $45 a box.
That's
he was
so
like, it's
going
to save me a whole lot of money. Yeah. So he had 4 boxes. He said, Brandy, this is going to last me a while.
Oh, so my friend's so sweet. You do good in the community.
I try my best.
But
so why do we do this?
Because community is our beauty. Have a great day.